Hello and welcome back to my channel. Today I've picked a topic which I have seen recently, a case of scabies. Scabies is nothing but an infestation. So I will be reading from this book I've picked today, Snapshots in Dermatology. So way into scabies kan so nga scabies to mizo tong chuan common lutuk Uithak kan ti hi dia Uithak kan ti wangkan uitanga kai ni swang no nia uiti atela wangkan uitanga kai amokan ti china chuak masabering ka so idua. So let's start reading from this book, which is this Snapshots in Dermatology. So scabies is an infestation of your body, which is also known as itch mite infestation here, and sometimes it's called the 7-year itch. It is a very itchy situation. Now I will not go into the history or details, but the important thing is that what is causing scabies? Scabies is caused by a mite, which is called Sarcoptes scabii mite. Scabies to Natna shik tela shik ani perang chu terote Sarcoptes scabii kan taksa a vachenga va omve thei ponama tanga he shik ti sang zinga mi ti na ni chu shik terote angani chu kan taksa omve thei chu apning chu Sarcoptes scabii ania mite ti zinga mi ni. Transmission and thinking kai chon the. Transmission occurs via direct close contact with an infested person. Fomite transmission may also occur. I don't think I have to explain too much here. Fomite transmission means transmission can occur through your bed linen, your bed sheets, your clothing, sharing of clothing, using the same bed linen, the same quilt, the same blanket which some infested person has already used, sleeping in the same bed where infested person has slept, or sleeping together in the same bed, or sharing a common living space with an infested person. So omzia chu kan chen puite kan anbula kan mu te kan kai tu berta close contact kan ti chuanin taksa in sik nai ang chi kha khana kai the ni omzia chuanin he lua mizo chang lua shik kan nei pon shik ne tang thoin kan kai chini ka tiang le khani meya shik chi khat tho ni amaro chu lua omlovin kan taksa om chin tani. Now what age group is mostly affected? Children. The prevalence is highest in the age group below 5 years. Children below 5 years are the most common age group. However, we see a lot of cases in adults, young adults, especially hostelers, people who go out for camps, especially people who live in under sub-hygienic conditions, in overcrowding, especially in winter months where people don't take care to take bath or to wash their bed linen. So we see most of the infections happening in winter months. Heta chuan ain zia dan chuan no panga tam bera maro chu kan practice ha chuan no pang ba ka puitlinga po om thea tin chu kwaron thak thin te anom thin ta ni pakhatina kai to chuan chung kwa pona kai the. As I've mentioned, if one person is infested, you can have the whole family who is having the same problem after a few weeks. Now what are the clinical features? Heta hen pawimawh deuh chu clinical features omzia chu so firstly, itching is the predominant symptom. It's very itchy. Then the itching of scabies is characteristically described as worse at night. So it comes out at night because the mite will come out from the burrow, which is, let's say the burrow is something like where the mite builds a house in your skin, on the surface of your skin. So it's called a burrow. So it comes out from there to lay eggs on the skin surface. That's why it is very, very itchy at night. Zana atui turin ron swak trintani. Tu wanton zana athaklang puita. Scabies characteristically involves the webs of the fingers, flexor aspects of the wrists, elbows, anterior axillary folds, and umbilicus, periumbilical region, genitalia, and upper thighs, knees, and ankles. In females, nipple and areola are also involved. The back is rarely affected. The lower buttocks and navel cleft are most common sites. Ito pawimawh ber chu ka aom tam da chu heta ban re ka te kan kutkar hemi kan put zong trăng in kara te om tu ta a kan sanapun na lai ban re ka te om tu ta a tin alum lai kan ti zak noi te kap te malpui te nu te noi te kha khanum du a tin lai area hemi kan lai a po khan om fo thin ta ni tu ta chuanin mi pa chuan common le deuh chu an kapa khana oma an cerebral available pakhat pani le compound scabies angin kan ngai thin ani. What I want to mention here is that it is very commonly seen in the warm areas of your body, like your underarms, your wrists, between your fingers, your finger webs, in your inner thighs, your umbilical area. Is usually not seen over the back. It can be seen mostly in those areas where there's maximum warmth, because the scabies goes and looks for a warm place to stay. And it's also very commonly in a male patient if they come with a single lesion nodule in the genitals, in their private area with itching, very badly itching at night. We usually consider scabies. Mi pa chuan soi tawng khanin kap area common ta ni a type chi sang changai chuan kal lo tai la. What complications can occur because of scabies? Secondary pyodermas. Secondary pyodermas means itching, scratching can cause bacterial infection, so pus formation will be there. So obviously we will have to give antibiotics in that cases, and usually that is the most common complication we see. Scabies complication so one complication so scabies shim Natna ba ka khan enge thil danga thlen thei scabies lo om to wang khan pun thei ni hia pun hi common nu to ka hia pun na sat phei chuan in antibiotic course pek tel venge ngai china noi chi te ai chi te tu chu common de wakat mu chu ni a thaga wangin hian lo thei lewin anom china kata khan tin te lo fai lo wa hia pun khom thei ni chuan complication dang pom thei chu soi lo me la. One treatment namakalang. Oh, let's go to treatment straight away. What do we give? So there's a picture here showing that this person has scabies infestation, and there are burrows here in the finger webs. They are common very commonly seen. They can have infections in this area plus the wrist. So these are very common sites. Now treatment is basically based on killing the mite. Kami amait aron thaksiam tu kan taksa cheng ve tatla takha tha na khani me ya kan man common ber chu permethrin 5% lotion hi ni permethrin 5% lotion. This is the most common treatment modality which we use. It should be applied overnight and repeated after 7 days. How do you apply this? Usually we apply this on the whole body below the neck before sleeping. You apply the lotion underarms, you're applied in the wrist, in the finger webs, everywhere, and then you sleep with it and take bath the next morning. And very importantly, you have to repeat it after 7 days. This is because what the first application has not eliminated, like for example the mite which has recently hatched, the eggs which has recently hatched, you have to reapply. Omse chu permethrin kan noi yan kan ho chin noina pangjong mudona kan noi swak feka chuan contact period kan ti atam doi tho chung kada kar som pani vela ngai ve ta ni zanda re te noi chuan jing da re vela in bol thei ti na ni chu khami contact period kha apoi mo emema tin khami kha i noi khanin kar khat nu a cham che khanin khoi khat noi le angai china ang che in a chan chu I atui alo keu thara kha I kan noi le khan pathat le tu rangai ni ta ni voi khat noi chaw tok lo ti na ni chu ni tin pe ni ro ti na treatment modality tang tam tak po mama se kan man tlang lon le kan mu tlang lon chok kha common pir ka karon soi ni there are many other treatment modalities which are mentioned here, but I've only mentioned permethrin because it is the most commonly and the safest which we use. It is safe in pregnancy also. It is safe in babies who are more than 2 months of age. No te apo man the ma se no te thlanian an pel nuwa tlani ai upa le rai pora te pokan pe thin thoni safety na ni chu bok le thak le khatiang om kha chuanin steroid cream antibiotic te steroid cream te kan petel thin thowa that is cases in. So we apply steroid creams and antibiotic creams also depending on your case. Now what the book has mentioned here has not mentioned here, but which is very practically very common, very important, is to treat your surroundings. Surroundings means your bed linen. So what we usually tell our patients is they will take all their bed linen. Bed linen means bed sheet, pillow cover, their quilt, their blanket, whatever they're using at that moment, plus whatever clothing they are wearing. They will take that and they will soak it in hot water. This is very important. It is not warm water, it's hot water. They will soak it for 15 to 20 minutes so that the mite is also staying in your bed linen, your blankets, etc. should also be killed. And your clothing of 24 hours. This, we usually just tell them to do this for a single time. It is best to do it when you apply that permethrin cream overnight and you're going to take bath the next morning. That morning itself, you take your bed linen, your clothing, and then you soak it in water. Washing is normal. You don't have to add anything else. You don't have to add Dettol or betadine or anything, and then disinfectant to the water. It just has to be hot. So the temperature will kill the mite. Heta pawimawh lutuk chu in taksa ka in dam vek to nu khanin nangmani le in chung te kha in mutbu tang te khan an lo kai non le thin ta nangmani po in dam vek to nu in mutbu a in kai non mutbu tang in kai non le theini dam do in noi in lo noi ta atuk zinga in boil rol khan ve kha che ti anga in mutbu in phala in sin lai in lukham khe song song te in lakho manga tin in thom do hak lai ne in lakho manga tui saver vora tui lum pep panilo nia tui saver vora minute som panga tanga minute som ditel in che awang panga chuan supa ngai in suang he he tel lo chuan nangmani kha dam vek to nu pon infestation kan ti in thaknon le thei ti na ni chu in mutbu train in kai hon le thea hemi hi apawimawh lutuk ta mutbu tanga kai an tama entina mi khwal thom tho kha lo ni ta se kha ka in treat tel nge ngai ta in mi khwal khan scabies lo ni chuan uithak lo ni chuan a mutbu ka in treat tel ve ka ngai ti na ni chu hostel a po chu tiang bukin hostel an lut ta hostel train non kai ta a hostel an mutbu vak ke na kha treat tel ve ka ngai wang in atlang win practically chuan anon in enti re chuan hostel an thom no in lama treatment ti turin kan hon ter chin. So as I've mentioned earlier, you have to treat your bed linen. So especially in hostelers, it is kind of difficult, practically difficult to treat all the bed linen. So we usually advise them to send it home so that the family members will treat it and then use a fresh bed linen in the hostel. So this is a very, very common infestation, especially in a developing country like India and many other countries also. We see it almost every day, especially in among people who are having overcrowding, where many people have to share their bedrooms and beds. It's very common in camps, very common in hostels. So it's basically, it is contracted from person to person. So close contact is very important. Kasi itong kanin hostel arte camp patanga run swak te entina night camp hostel ate punan nei ta khang te pokanam theita mi pakhata tanga kai ni mishing tanga kai ni uithak ti wang khan ui tanga kai ni lo ti khasha turani til nge akomon mema ni tin de thokis kan mu thina ni chung member thanem tak room in share ngai te comment share ngai te kanom thina khanga te khan pakata thak to chuan abulam mu te an thak ve ngal tura ngai ani I kan treatment pack dan tlang pui chuan chung member pakata thak to chuanin member zong kan treat tlang pui an lo kai ve to tura kan ngai achan chu kan va treat lo khan nge anu zela khan anon kai ke poka kai ve ti kha om le zel wangin it is always best to treat all the family members at the same time. Voi kata and family members also treat ka apawimawh emani comment lama zona kan chang don ya. If you have any queries, we can answer from the comment section. Thank you. Please stay tuned. Hini ma henga witra I thenten thak ve em hostel a chuan ale lam kalo en lo jangma che mo ruma inting em mieng jang yom chu
som di le pali ve
dormitory angin khomoi kor khan lim te re hilai thak izak na ya amem na saim
na sai tu
in here su drink mi zana thak zal tiro
zana
I kap le mal vela om vekem mal tu thak tiro hale nam kalo en lo
lai ve ni thak thai tu kon
zana in here jenga zinga chona zia
jing lam chang jo ji
in hostel nang ma chang mo thak midang an lakai lo nge midang an thak su midang an thaka I thak ve ta nge anang nang mai ron thak ma saber chente ne ko thom no in trom te amem me lo ma I kapami chu bok engjang nge omang I ser ve la khan I hiat pilem kambo kalo en lok achan chu apil chon mo antibiotic pack dilingai do na helai ta ka I kaplai ta ka kana enam tilang ra oh ka ring om ni ka kami lo khane ka ti isira ta khan bol om em pakhatal izun na vel bor tiklaro ka endu titlave gra ki kol ka patlave gra bol om tira ring om ni tel ni kha en lo ila chani isoi si dawa treatment angai kha ka tuna iron kalpui ka chu Uithak ania mo thakom zia chu nangma khanin enga moni tero te se tu om tina ni me nidang poi kai the o hostel a chon common lu to mo ani le entika nge inin bol thin hostel a inting kan ti ang in warden te na dain jak taila in bol angai ti taila in bol thengem khoi ange in bol thin hostel a tui om lo wang ani mo jinga in bol har sangem har sa lo mo zana in noya jinga in bol angai do na mo chu in warden ne na tang ka zia kang mo in bol hun lo tu le ka in bol khangai do na treatment na ken telani bangin nam doi ka jan kho in chi anga ya tagar som pani nu vela in bol ngi ngai ta I bol ti fai ngai chu ka zia ngai ni chung ta thak
sa ni so ma hang gan du thang
I chung ta so ta tanga ron kai te pai ni thei tho mo I chung te jen pui te iron kal san ho te ka thakan omem le om lo mo mut bu vel thak ve ka ngai thina mo thak ka har ome chung te ta nam si om si lo an om mo pai thak ve tu hostel ar chu ne mo hi en le zana noi tur ka ti hi zanina mudona entina zanin naktuk zingi lo in bol don chuan zan nei noyang in bol thei don chuan chu zot phot don ne ngonga chin noi lam pang zong in noi chuak ve kanga zan khoi ni mut puyang lotion ania ikut kar te kap te vai ni chul chok ve kang chuan I mut puyanga zinga in bolang zinga in bolang darkar sompan entina dare te noi chon zing dare nuwa chon in bol thei ti na ni chu chuan kar khat nuwa noi le tur om je chu ni tin ani lo ti na ni thuma tanga kar khat chu eng ti nge le poi ni thuma ni chuan kar le ni som ni som zana I noi le don ti na lenga atuk zinga in bol le ang anga yang chen kar khat nuwa noi le tur ni thum dana ni na zana noi tur zinga in bol tur in noi na tur zan in bol na tur zing kar khat nuwa noi le tur in noi le tur zan ni som pakhata in bolang pithia mem chon he bola piang a khan zinga le za nei noyang kar thum chung bol cream me chwane te ni noi te lang chuan jing le tlai ringwa ma he noyanga karli tanga karnga veli noi chuan are me ka be se chon he I kapa khan powder noi ve je ang ringwa ma ta na siam ni ti ni phulang he chu in bol la mai bol lo mo iti ro mangai chuan sabon hi he ringwam sabon ni man ve ngai in bol nan chon poi mo du chu tu na I mut bu man lai ka mo I bed sheet te pillow cover te khata khanin ase tu te ro te kha chambang ve the ta ni I Uithak khanang ma ka dam vek to ta la I mut bu tang khani kai non the ti na ni chu ta ka chu hostel a chon in tinge kan tiang helai mi local mi ni lo phe chonin I ti the da na chuan I chung te ta I keng lu tanga I ta tu nei man lai I hon ti ranga chuan in lama an nin an lo suk fai sak chenga suk khan suk pa ngai thei ta ni engma dam doi enga moni te langai lo ma se tui sa ngai minute som panga an che ngai 15 minutes ka tui sa I mut bu ti khan I sin lai le pha lai le lukham khe sang chi kha an che wang anga chuan an suang suk pa ngai na suk vek the chumi chu in ti thei lo ani chuan in ti thei lo ni chuan I mut bu chui thlak vek ngai tho ma se I mut bu man lai kha I su thei lo ni chuan rambo polythene moni I keng lu tanga ta chuan air tight in I dang air tight om je chu borak lu thei lo in I ton phui vek anga air tight in I dang dar ka som ni pali vel Tritiamem ananda shikhai tha I that don borak lu ti lo chuan in ananda shikha thi tur anga ni ta ni I thom no le I mut bu cham bang theya kha kami ka kan ti tel lo chuan nang ma khai thak non le thei I mut bu vela tangin Tritiamem tu chu poi mo lu tu hi chon suk chu thabera tuisa che khan ase I thero chonin air tight in dar kar somni pali mo 48 hours mo en tu kha pakhata chon leng vek don lo da rambo polythene king lu te ma la reject pakhata reject da nga I ton phui thlatanga Tritiamem atuk le vele hong chowang sulopon chu ni som pakhat jing in bol le ngai kha hemi te pani hi in bol jing tur ka tik hi ta hian zinga a in bol theingem ti zo don nia nuarden chu se thiamem kami pani te kha o chuan ringworm in nei wang khan mo itin ka toiro se o in hiat englo vek the nia towel te kha chen te nen in trom lo tur phoro that tur in bol zo piang in towel ka in chungai ki khai ro re ngo chuan tuna mun khat le ka i ringworm ka mun sang sang a in trai dar the tu chu lo sha reng tur chuan midang nen engma in trom lo tur sabon etc thom no sang vek tur tuna khan thil pani midang ina an kai the le midang atanga I kai the om da ni I thil pani ne kha hostel a chang midang kai lo the sang tur nen engma in share lo tur pawimawh lutuk ka hi treatment lukin a pawimawh ti sha tur ale se thiam ve kem ka thil soi kha atam ro pui se he mi zo tong ve kin ka ja hi tuisa a mutbu minute som panga cha bla 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 ka ja fek I chiar ve don ne ale